Let's stay on matters health for a moment. Now, the Ministry of Health says the decision to ban the controversial Sputnik vaccine was fueled by cases of the jab being administered in unqualified stations, including people's homes. The Chief Administrative Secretary in the Health Ministry, Dr. Aman, told the Senate Health Committee today that 527 people who received the jab will get the second dose. However, more than 73,000 doses cannot be used, and importers of the vaccine will have to consider re-exporting the Russian-made vaccine. Gov't has the details.
The decision to ban the importation, distribution and use of the Sputnik V vaccine led to controversy in the country, with the Ministry of Health shifting goalposts repeatedly, at first acknowledging presence of the vaccine and later denying knowledge of how the vaccine came into the country.
Is it that what the right hand is doing, the left hand does not know? When Poisons Board issued the license, were they doing this without consulting the ministry, or are they not? Are they required, or are they not required to consult the ministry?
Does it mean that the Pharmacy and Poisons Board did not at first involve this emergency committee? Does it mean that there is a conflict between this committee and Pharmacy and Poisons Board?
CIS Dr. Aman told the Senate Health Committee in an online session that the National Emergency Response Committee received reports that the accredited distributors engaged in marketing of the vaccine contrary to the guidelines of the Pharmacy and Poisons Board, and that the jab was administered in facilities without accreditation, including people's homes.
During its deliberations, the committee received reports with information that, with respect to the Sputnik V vaccine, the appointed distributors were engaged in marketing of the vaccine in contravention of the guidelines issued by the Pharmacy and Poisons Board, which prohibit marketing when a product is still under emergency use authorization.
The members of the committee, however, declined to admit a statement which CS Mutahi Kagwe failed to append his signature to, with CS Aman signing on his behalf. MOH insists importation of the vaccines will be the prerogative of the government, at least in the foreseeable future.
Following reports of irregular deployment of one of these vaccines, that being Sputnik V, and noted that the gains made in the fight against the pandemic may be reversed by the introduction of counterfeit vaccines into the Kenya market, putting the country at further risk of COVID-19 spread, increased morbidity and mortality.
527 people received the Sputnik V vaccine and will receive a second dose, with the rest of the doses reportedly in the process of being shipped out following the ban and a push by the importers to cut on the losses of importation. The Ministry of Health has recorded a positivity rate of 14.9% in the latest COVID-19 figures, with new infections at 1,698 people out of a sample of 11,352 tested in the last 24 hours. 16 fatalities have been recorded, one being in the last 24 hours, and 15 recorded as late audits. The total fatalities now stand at 2,292. 456 patients have recovered, with 1,620 patients admitted in various facilities, of which 235 are on ICU. Meanwhile, Nairobi Regional Commissioner James Kianda has issued a stern warning to residents who, he says, continuously flout COVID-19 containment measures.
And I've singled out some estates. I've indicated this has been happening in Kangemi. I have to single it out. From tonight, we'll be dealing with those areas. It is happening in Mukuru Kwanyenga. It is happening in Uruma and Kariobangi. But we will not allow people, because what is the essence of...
Kianda saying police will enforce containment measures and arrest those flouting regulations. Gov't, Citizen TV, Nairobi.